Does anybody have anything they want to ask or say? Nobody? This is my lecture, so I don't know if I just bore you or you want to get out of here. Okay, well, if nobody has any questions, tomorrow, be there on time, because I like to start on time. We'll cover all the bases. And if you're a dentist or a physician, I see no reason why you can't pick up a laser after I'm done and begin to do it. As long as you're not afraid of the baby or the mother and are willing to do it, as long as you follow my directions. I know of no contraindication. I've never had a problem, although I will show you one child who did have a little bit of bleeding, because sometimes tongue ties are complicated. They're not only distal to the salivary ducts, but you can have an anterior tie, not to the tip of the tongue, but an anterior of the salivary. And those are the ones that we tend to bleed the most, if they're going to bleed at all. But I've never had a bleeder since I've been using lasers. And I can guarantee if you have one bleeder, you'll never get another one, because if you shoot an arterial, not on a newborn, but on a 2 or 3 or 4-year-old, it'll shoot about 5 feet across the room. You'll never do it again. But that's why you use loops or a microscope most of the time. So, I mean, I'm more than willing to ask him some questions, if not.
So we'd just like to open it up for questions of the parents who spoke, as well as Dr. Kotlow. If you have any questions, any thoughts, any experiences you want to share, please feel free to do so.
A benefit to going sooner than later, and I've talked to moms who were expecting it and didn't anticipate this, have a younger child, and say, well, I'm just going to wait until my baby comes and we'll all be together. How is there any impact in waiting, say that extra 4 months or 6 months or 8 months for that older child?
It's like waiting to postpone an appendicitis. When you have the symptoms and it's diagnosed, you want to wait 2 or 3 months before it gets real bad and get real sick. There's no reason. I'm doing preemies. Okay, I think the smallest I have is about 4.5 pounds. You can fit in my hand. It's a little tough doing the exercises sometimes, and you can get no fingers in. But I have instruments I can get into the mouth, so that doesn't bother me. And I have tongue blades, which I show parents how to use. So, I mean, it depends on the criteria that I use as to the degree of a tongue tie or a phlegm. But to be honest with you, I don't need to see the baby. If you tell me your symptoms, I can tell you the problem. Because there's really no other reason for you not to be able to nurse other than tongue ties or lip ties on a normal, healthy baby. I've not seen a baby come into me who I didn't agree with the person who diagnosed it and who didn't get good results on. There are some parents who just don't want to stretch and they give up. But that's the key. The key to diagnosing is how to hold a baby, but we'll go into that tomorrow. But the answer is, if you see a problem, I see no reason to wait if it falls in certain categories. I mean, there are some lip ties which I don't do because it has prevented nursing. I mean, like I'll tell you tomorrow, every baby I see, I treat, but I only see babies that are referred in. So, you have a baby tomorrow, and you bring your child to me, he's now 3 and 5, and they're coming in for routine dental care, and you're in the reception area, and your baby is 4 weeks old. And I say, oh, are you nursing? And the answer is yes. Any problems? No, everything is fine. I said, great, can I take a look at your baby? I'm trying to find a newborn that doesn't have a tongue tie, and who's not having any problems nursing, so that I can go in there and take some pictures, because everyone says, show me a baby who's not tongue tied. So I say, okay, I go in, I take a look in the mouth, and then I say to her, any reflux? Oh, terrible reflux. Any colic? Oh yeah, the baby sleeps sitting up all the time. And before you know it, she has the symptoms. And so a lot of times, that baby who has no problems is having problems, but it may not be latching. Maybe other problems that are there, and we do it, and that takes care of that problem. So the answer to a lot of this is, and as you said before, it's probably a significant, every baby has a tongue tie. Or I should say, every baby has a lingual feather. Some babies have a very flexible floor of the mouth, and that tongue can function because it takes the floor with them, and they don't have any problems. And if there's no problems, and it's totally asymptomatic, if it were to fall in my classification of 3 or 4, then I'm going to do it for speech purposes later on down the line. Why, you know, you get the story. Wait till they can't. Wait till there's a speech problem. Well, you know, wait till your car tires go bald, you have an accident, and they get your tires. Why wait for a problem to develop if the probability is there? Anyway, let's get into tomorrow's lesson. Any other questions?
What would you say some of the key questions to ask somebody that is willing or has performing surgeries? You go to them for a referral. What are some of the key questions you would ask in order to know that, to give yourself that confidence that you're choosing the right practitioner to do it?
Well, first question, how many have you done?
And so what's the right number?
You want to be the first one?
Someone's got to, right?
Well, absolutely. Someone has to. Someone has to be. I think when you go and see someone, you get a feeling as a mother, a gut feeling, what kind of confidence you have in his ability, based upon how he examines the child, and how he talks to you, and what's the follow-up to it. Okay? If he doesn't examine the baby correctly, he can't diagnose it, therefore he can't treat it. So if he looks and says, oh yeah, there's a tongue tie, we'll fix it, that's not the way to do it. When you say to him, what kind of aftercare, he says, oh nothing, the baby will do fine, I walk out of the room. If you find you go someplace and they do the procedure, and the doctor doesn't come back into the room and say, okay, let me take a look at your nursing, I want to make sure that the baby can flange properly. I would be concerned too that it's just a mechanism of getting you out of his hair, or her hair. As far as the numbers that have been done, that's hard to say. You're right, they've got to start someplace, and if nobody here is doing them, and you want to get dentists to do them, eventually they're going to have to start someplace. They probably shouldn't start on a preemie, if the child weighs 5 pounds, but they have to learn, and again, tomorrow I'll go over how to control the baby's movements, and how to visualize what you're doing, and how to diagnose. So those are the things that I would probably ask, just as if you were going to go in and have some kind of surgical procedure. You know, if you were going to do cosmetic dentistry, you don't want to go in and say, you know, I need a facelift and have a guy never done it before. Any other questions?
I have a question. There's a bit of controversy about lip tie and the presence of tongue tie with them. So the question I want to ask is, do you ever see a lip tie where there's not also a tongue tie? Like, do they go hand in hand?
You know, when I first heard of the breastfeeding dyad, I thought it was a lip and tongue tie. I didn't realize it was one. So I decided I can't call it a lip tie. I can't call it a breastfeeding dyad. I do them both on every child, automatically. 1, because patients come so far, and 2, because I believe that when that upper lip can't flange, you can't get it out of the open. After saying that, when you bring your child to me at 10 months of age, and you're still nursing, and the front teeth are in, and you have tooth prints all over your nipple, I've released only the lip in some of these kids because I'm not sure at that point a posterior tie has become a real factor. And then again, if you come from Alberta down to Albany, and I find a posterior tie and a lip tie, I'm going to do them both because you don't want to come back. But if you lived around the corner, I might do one and say, let's do the lip and see what happens. But it's so easy to do the posterior tie. It's rare that I don't do them both until the kids get older. But you know, if they get to 2, 2.5, or the parents no longer nursing, then I may release just the lip and say, okay, I don't know what effect posterior tie is going to have on speech down the line. Now there's a woman in Australia by the name of Carmen Fernando who wrote a book, Tongue Tie from Confusion to Clarity. I went into Australia and lectured, and I got licensed to do dentistry there for 1 day. And she sent me 4 children, not babies, to do. And none of them would I have done, because they were all posterior ties. One was autistic, one was a teenager who wanted to speak better, and 2 were minor kids who had speech problems. I did all 4 of them, live, in person, kind of thing. And 6 weeks later, she said they all improved. So, if you have a speech problem, I'm definitely going to do it. It doesn't have to be that big web of tissue. So it really comes down to symptoms and classification and what a parent wants me to do. I'll give them the options. And again, if you're local, I may say, well, let's see what happens.